When you are sick, you need a good ambience to pick your medicines. Maogola Pharmacy is here for you. Has human medicines for both retail and wholesale. Found in Sembabule and Chigangazi Town Council. Call us on 0200 908 184 Sembabule or 0700 577 241 Chigangazi. At Maogola Pharmacy, we serve with care.
Welcome to Bikoff Medical Center, located in Maskasi and Sembabule Town Council. We have a dedicated team of health professionals ready to serve with love and care. We offer a wide range of services, a diagnostic laboratory, ultrasound scan, dental services, maternity and surgical services, physiotherapy, For more information, call us on 0759 54 1708 Masaka and 0759 54 1703 Sembabule. Bikoff Medical Center, we treat good heals.
Okay, good evening colleagues. Welcome to my live today. It's the first day of February 2024 and again we are live at Ask Dr. UTHUMAN. I told you, for those of you on YouTube, do not forget to subscribe to Ask Dr. UTHUMAN YouTube channel so that you can receive health information regarding fertility. And today we are during our live, we are going to be, I implore you to ask questions. Ask any question of your choice, but those questions should be regarding fertility and reproductive health. I'll try and make sure that I answer each and everyone's question today, though I have less time, but I'll try to answer each and everyone's question. And for those of you who would like to have a private chat, because not most of you are shy to ask questions from here, but you'd like to have a one-on-one with me, just go to the website and type in www.druthman.com. Follow what the website tells you, then you'll be able to get in touch with me to have a private chat, a private conversation, and you get your issue solved. So right away we are beginning with questions, and I will start with this question. Okay, Lydia is saying welcome doctor. All right, Empress, welcome. All right, Ulule Hassan is saying doctor, salamu alaikum wa rahmatullahi wa barakatuh. We are live. All right, how are you, my friend Hassan? Then this one is saying Lulu Lily is saying I don't hi doctor, I feel like I am pregnant because every time I feel pain in my lower stomach. In my lower stomach. Now, I think I want to make this one very clear to you people. Let me clear this a little bit. Now, some people will have signs of pregnancy when they actually when they are actually not pregnant. That has happened so many times, and the issue is about psychology. Because, you know, someone really badly wants to get pregnant. They are psychologically, their minds are all about getting pregnant. Now, when you do not get pregnant, there is the way the body mechanism tries to compensate for you, and you have that feeling like you're pregnant. Actually, I've seen women who even develop motion sickness, they develop craving and so on when they are not pregnant. but those are pseudo signs of pregnancy that comes as a result of someone overthinking and someone actually that is those things come about when you start having stress as a result of failing to conceive. So that is not true that you are pregnant, but the reason is that it is just psychological that you start feeling and getting those signs. Some people even miss periods and think they are pregnant, but when they are not. Let's continue with another question. This one is saying, Barry Namudu, good evening, doctor. I have a 29-day cycle. What is my ovulation day? Your ovulation day is on the 15th day. If you have a 29-day cycle, your ovulation day is on the 15th day of your menstrual cycle. Papa Mama is saying, hi doctor, how effective is Clomid if you are trying to conceive? Clomid is effective if you're using it for the right time. First of all, for the right cause. First of all, Clomid does not treat infertility the way you think. Clomid is a medicine that contains luteinizing hormone stroke FSH. So we only give it to those people who are lacking FSH or LH. In other words, if we have a problem with the levels of LH or FSH, that is when we give clomiphene. But some people, when they fail to conceive, and I think it is also a mistake by many or some of us, the doctors, someone comes, they are talking about failure to conceive, and people just end up giving them clomiphene. Clomiphene, what is clomiphene going to do? Because just to give an example, if someone has a blocked tubes, why are you giving them clomiphene? So the most important thing is to find out what is causing this infertility, and then you get treatment. So clomiphene is effective if it is applied where necessary. Then we have this one is saying, can withdrawal method make a woman pregnant? Of course no. Withdrawal, because but when we are talking about withdrawal, we mean effective withdrawal. Okay, effective withdrawal. There are some people who don't withdraw well. You know, that's why I usually don't encourage people to use withdrawal, because you want to take you want to stop when at the time when it is really too sweet. Because remember, that is the time when a man feels they are high. Okay, that's when the game is at its peak. And that's the time you're supposed to withdraw. So most men fail to withdraw properly. They fail to withdraw properly. So by the time they get out, they have already dropped something there. So at times it will not be effective because of that. But if it is done effectively, then there won't be any problem. You will not be able to conceive. Secondly, withdrawal, I have already said it here. If you're to use a withdrawal method, if you don't want someone to conceive and you're using a withdrawal method, make sure that you're having one round every 24 hours. One round. But if you're going to have 2 rounds in the 24 hours, for example, you slept at 8 p.m. and you've had sex at 10 or that time 8, you're supposed to have only 1 round till the following day. Why? Because when a man ejaculates, some sperm, some fluids remain in the tube. That is for the first round. Now, when you come for the second round, those sperms you left in the tubes will be the first ones to be deposited there, even before you come. So that's how the withdrawal method sometimes fail to be effective. Okay? So, but otherwise, if you use it effectively, then there is no reason as to why you can be conceiving. Okay, then we have more questions here. Barry Namudu, doctor, my wife show her period on the 28th December month and start her new period on 26th January. It's 29 days cycle. I don't know if you calculate, if they are 20, because we said 28th December, let's calculate for you and see if it is a 29 days cycle. Let's find out. Let's find out if it's a 29 days cycle. So you started the periods on 28th of December, 28th December 2023. 3, I think. So we have 28th December, 29th December, 30th December, 31st December, then 1st Jan, 2nd, 3rd, 4th, 5th, 6th, 7th, 8th, 9th, 10th, 11th, 12th, 13th, 14th, 15th, 16th, 17th. Third again on which day? 26th. Okay. 17th, 18th, 19, 20, 21, 22, 23, 23, 24, 25, 26. That is January. Okay? That is January. So now, if you count, this is day 1. Let's use this. That means this is day 1. Day 1. Day 2. Markers will say what is it called. Okay, this is day 1. This is day 1, day 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Oh, let's repeat. 1, 2, 3. 7, 8, 9, 10, 11. This is 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. So it's a 29-day cycle. You're right. It's a 29-day cycle. Yes, it is a 29 days cycle. It is a 29-day cycle. So your wife has a 29-day cycle, and I think you can start from there to find the ovulation day, to find the days is safe, and so on, etc. Then we have another question. Jennifer Ndindwe is saying, hi doctor, good evening. I have my period last month, 20. So when is my ovulation day? Thanks. You see, we cannot tell you your ovulation day when we don't know the length of your menstrual cycle. Okay, so tell us the length of your menstrual cycle. We can be able to tell you your ovulation day. We have someone else here is saying, what might be the cause of not getting pregnant when you have many sex in a month? What do you mean by many sex anyway? I think you're talking about infertility. What can cause infertility? Now, you may be having those, what you're calling many sex in a month, but when your husband does not have powerful sperms. Because I have already said that the issue of infertility, the issue of failing to conceive is two-way. It can be as a result of failure by the woman or failure by the man. What can happen to the man? The man may be having what we call male infertility, whereby he's having either low sperm count or poor quality sperms. So even if you have sex every day and you're having poor quality sperms or low sperm count, you will not be able to conceive. So that is number 1. Then number 2 for women, why a woman may fail to conceive. Number 1, a woman may be having fibroids. Okay, you may be having fibroids in your uterus. If you have fibroids in your uterus, it may be very hard for you to conceive. Number 2, you may be having other masses or cysts in your uterus. You will not be able to conceive. Then another thing, you may be having blocked tubes. If tubes are blocked, you will not be able to conceive. Another issue is that you may be having a problem with your hormones. Okay, if you have fertility hormone, if you have fertility hormonal imbalance, your hormones are not balanced, you'll be having a problem with conception. So there are very many causes, like I've listed, as to why someone may fail to conceive. Then we have another question here. It's coming from MC. Oh, okay. Aisha Nachintu, hello doctor, I had my last period on 10th September. When is my expected date of delivery? Expected date of delivery. All right. Expected, we are going to calculate for you the EDD. Now for those ones who are pregnant, we can use this to calculate for you when you'll be able to give birth, okay? So we are going to do this. This is the math we have to use. You had your last period, LNMP. First of all, congratulations upon conceiving Aisha Nachintu. All right, so LNMP is on 10th of September. 10th September 2023. So if LNMP is 10th of September 2023, LNMP, which is 10th September 2023. So we shall add 7 here. Someone is going to ask me, where do you get 7? We shall add 7 there and also add a 9 here. That is the formula. We shall add a 7 and a 9 there. So when you add them, you'll have 2023. You add them in isolation. This one, 9 plus 9 is 18, and this is 17th. So what does it mean? In actual sense, it means you will give birth on the 17th of the 18th month of 2023. This doesn't make sense. What does it mean? If you have 18 months, this makes a year and 6 months. So what we are going to do, we shall 18 minus 12, that is a year. We shall get 6, which means we take 1 year here and we get 2024, and then bring the 6th month, which is June of 17th. So you will be able to give birth on 17th June 2024. That's when you'll be able to give birth. Okay? I think that is also very, very clear. Okay. Will you please answer me today? What was your question? What is the question? Just give me the question, I'll answer. We have MC Ngozi saying, can a woman above 44 years with regular period use clomid to boost her ovulation while trying to become pregnant? Are there any disadvantages? Now, MC Ngozi and the rest of you. MC Ngozi and the rest of you. Before you use clomid, first make sure that it is what your body needs. It is not that whoever has failed to get pregnant will have to use clomid. No. Use clomid when it is necessary. We have to first confirm that what you are lacking in the body is clomid, not just swallowing clomid anyhow. Anyhow, people just ram into pharmacies, they are just taking clomid because they have delayed or failed to conceive. Confirm that the problem is clomid. Is luteinizing hormone or follicle-stimulating hormone. Clomid is a supplement. It is a drug containing, it is a gonadotropin. A drug containing luteinizing hormone and follicle-stimulating hormone. So if the problem is that, then it is okay, you can take clomid. But if it is not the problem, you're taking clomid for nothing. Then we have Belinda saying, Doctor, what if having sex all days before ovulation day, but didn't have sex on ovulation day itself? Is there any chance for conception to take place? What if having sex all days before? Which days? All days before. All right, yes. Of course, people do not only conceive on the ovulation day. People conceive, you can conceive 5 days before ovulation and even 3 to 5 days after ovulation. All those days you can conceive. Though we are saying that on the ovulation day, that is when you have very many chances, all high chances of conceiving. But you can still conceive on other days. So it is possible to conceive on other days. Okay. Then this Mensa Isaac, hi doctor. My wife menstrual cycle keeps changing, sometimes 26, 24, 26, 27, 28, 29 days. Is it considered normal? Yes. We have what we call an irregular menstrual cycle and a regular menstrual cycle. We also have an abnormal menstrual cycle and a normal menstrual cycle. A normal menstrual cycle is that cycle which is between 21 and 35 days. A regular menstrual cycle is that cycle whereby someone will have their periods, for example, every 28 days. So their cycle is 28 days, it doesn't change. That is a regular cycle. Irregular, the days keep on changing. So they can keep on changing when they are normal, as long as wherever they change to is between 21 and 35. So we have a normal irregular menstrual cycle and a normal regular menstrual cycle. So it is normal to have that, though we shall call it an irregular cycle. Then this one is saying, Bare Mahmoud is saying, thanks, doctor. I am watching you from Italy, Milan. Doctor, what to know when her ovulation day? You're watching me from Italy. How are the Italianos, the Italian mafias? We used to watch movies of Italian mafias. The they are called what? Mafioso. The Italian mafioso. All right, so your question is saying, doctor, I want to know when her ovulation. What do you mean? You want to know exactly. Ask your question very well, Italiano. Ask the question clearly, I will be able to answer. I'm not getting your question. We have Lydia. Doc, I have a 28-day cycle. Good. I had my period on the 1st of January and it came on 20th of January. Please, is it normal? You had it on 1st of January, then it came again on 20th. That is not normal because those are even less than 21 days. That is not normal. Probably something happened. Number one, you might have used emergency pills. Some women, when they use emergency pills, their periods change. Or you may be on a family planning method, which is hormonal, or maybe you're undergoing stress. But the periods are not normal. The cycle is not normal. Lulu Lilis is saying, hi doctor, my period was in the 19th December, and when it came on 17th, is this normal? January 17th, that is normal. That is normal. 19th December to 17th of January, it is normal, I think. That is around 33 days, 30 something days. It is normal. It is normal. Ramula Navankema, whenever I go to work abroad, I rarely get my periods. Now 9 months only, 3 times. And when I go back to Uganda, I get back to normal. I'm worried. No, you shouldn't get worried because sometimes periods, hormones tend to change when there is change in the weather conditions or the climatic changes. So it is normal. Don't get worried about that. Malcolm Botia is saying, hello doctor, I've got my periods on 18th November, then skipped my periods December. My periods came again on January 25 until 24th. When is my ovulation day? I don't know because you are even skipping some month. So to know your ovulation day, we need to know the actual length of your menstrual cycle. And to know the actual length of the menstrual cycle, since this is an irregular menstrual cycle, we are supposed to do that for a period of 6 months. Check on one of my videos. One of the videos where I taught about calculating the ovulation, the ovulation day, calculating the fertile days in an irregular menstrual cycle. You will see that video and it will be beneficial for you. Doctor, I was in family planning. Who is this one? Rachel Bizu. I was in family planning. I was in my family planning and removed it in 2022. But till today, I have failed to get pregnant. Which family planning were you using? That is the starting point. Which method of family planning were you using? Okay. Then we have another question here. Susie baby is saying, doctor, I have a 24 cycle. What's my ovulation day? A 24-day cycle. Get 24 minus 14. 24 minus 18, what do you get? 24 minus 18, you get 6. Okay? So if 24 minus 18, you get 6 plus 4. That is 10. That means your ovulation day is on the 10th day of your menstrual cycle. 10th day of your menstrual cycle is your ovulation day. We have GFF, GHH. Please, doctor, I came abroad with an IUD and it's now 3 years without using it. So I'm going to conceive after removing. I don't, if someone understands. Doctor, I came abroad, yes, with an IUD, okay? And it's now 3 years. So it's 3 years when you have an IUD without using it. So am I going to conceive? What do you mean, but you 3 years without using it? You came, please ask the question very well. I think the English is not very, very clear. I can't comprehend. Yes, Jamie Wahoo. How are you and where are you calling from? And be very loud.
How are you? I'm calling from Juba.
You're calling from Juba. Be very loud. What is your question? You're calling from Juba. What is your question? Okay, we've lost her. I think she doesn't have a good network. Let's go to someone else. Mensa Isaac is saying, Doctor, my supplementary question. With normal irregular menstrual cycle, how will I calculate the ovulation day? Go to one of my videos. This is a very long topic. Go to one of my videos. Check my one of my videos. It is saying how to calculate my safe days, fertile days in an irregular menstrual cycle. How to calculate my safe days, fertile days, and ovulation day in an irregular menstrual cycle. It is there on my YouTube channel. You check the video. It is very elaborate. You'll be able to get it. Doc, I paid appointment, but till today, no response. When did you do it? You see, whoever makes an appointment, we reply you, but remember you are very many, so you might have booked your appointment maybe yesterday or a few days ago when your time has not yet reached. Because right now I have people who booked in August and we are still answering them. So there are very many people. You just need to be a little bit patient. They will send you a notification when your appointment will be scheduled. So just be a little bit patient. It's only, but there are those that book for urgent appointments. Those ones we immediately answer them. But if it is not urgent, then you'll be scheduled. I have very many people. It's not that when you book there and then I will be able to answer you. No, we have many people. You can find we have like 200 people who have booked, and how can we answer all of them? So sorry about that. Then we have another question. Berry Namudu, yeah, doctor, you are doing a great job. All right, thank you. Berry, my wife have 29 days cycle. What is her ovulation period? The ovulation day is the 15th day of her menstrual cycle. That is her ovulation day. So 15th day of her menstrual cycle is her ovulation day. Then Susan Wangari is saying, hi doctor, can a person having irregular periods at some point, no periods, use Litrazole to conceive? No, Litrazole is like clomiphene and tamoxifen. We take it if the problem is LH or FSH. That is when we take it. So we don't just use it for the sake of using it. Okay? Yeah. Okay. So because first of all, not seeing your periods, Litrazole will not be able to give you periods. Most times periods are not coming because the levels of progesterone is low. So however much you use Litrazole, you will not get the period. So you need to first treat. That's why I usually talk about treating the cause. Hello, this is Sam. Hello, my favorite doc. How can I avoid another miscarriage? Empty sac. Now, avoiding another miscarriage, number one is that you are supposed to make sure that you know what caused the other miscarriage by doing investigations. Because they say once bitten, twice shy. If you had a miscarriage, okay, let's know why the miscarriage happened. If it was an infection, treat the infection. If the problem was hormonal imbalance, have your hormones balanced. If the problem was rhesus factor incompatibility, let you get a vaccine. In other words, whatever the cause of the miscarriage was, treat it. Then you have a normal pregnancy. I hope I'm very clear. Regina is saying, doctor, is it normal to have periods after 28 days, 24, or someone I have on 20? Yes, it is normal. That is what I've been explaining. There is what we call normal irregular and normal irregular menstrual cycle. The cycle may be irregular, but normal. That is okay, and it is very, very normal, and it has no problem. So there is no problem about that. We have another person asking here. Kezab Rose, doctor, I want to get pregnant for twins without my husband knowing that I used medical. Will you do it for me? Yes, I can do it for you. Simple question. I can do it. Game Solar Aziz Abiyodon, please, if someone use IUD not see in is menstrual normal. I have not gotten your question. The English has not Englished very well. I have not gotten the question. Please ask the question again. GFF, GHH, doctor, I meant that I came abroad when I was using an IUD, okay? But now it's 3 years without using it. So am I going to conceive after removing it? Because, you know where I get lost? You're saying 3 years without using it, and you're talking about removing it. What do you mean? Seriously, I don't get you. You went somewhere with an IUD. It is now 3 years without using it. For you, what do you mean by not using an IUD? Because if it is in your uterus, you're already using it. So what do you mean by not using it? I don't get you clearly. Someone clarify here. If someone has understood her, please let me know. Because if you're saying 3 years using an IUD, it's now you put in an IUD and went abroad, wherever you went. It's now 3 years without using it. What do you mean by without using it? Did you remove it? And according to what you're putting here, it's like you didn't remove it. Because you're saying without using it. So I'm going to conceive after removing it. What do you mean? What do you mean? Did you remove it? Is it now 3 years you removed the IUD? When did you remove it? We need to understand that. I don't know if I'm the one not getting your question clearly. Salome is saying, hi, doc. Thank you so much. I am learning so many things on your channel. Doc, is it true that control pills cause high blood pressure? Yes, to rise. Yes, 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 yes. There are some people who have used family planning pills and gotten a rise in blood pressure. There are people who have used an implant, the levonorgestrel, and gotten high blood pressure. That one is true. But it's a side effect. It doesn't affect everyone. You'll find that like 1 in 100,000 people will be able to get that problem. Ayomu Deng Waitang. Hello, doctor. I have been taking Litrazole for 5 months now, but I really failed to conceive. Which? Yes, you'll fail to conceive because the issue is, why have you been taking? Are you having a Litrazole deficiency? Because you're taking Litrazole. Is it the problem? Is the problem Litrazole? Okay? Is the problem Litrazole? Why are you having that? Okay? So that is the main issue. Is the problem Litrazole? That is the main important issue. Yes, hello, how are you and where are you calling from? Be very loud with your question.
Hi, how are you? I'm good. How are you?
Yes, what is your question? Oh, all right. So it's time for people to ask questions, so you can just take off. We are in the middle of questions. All right. So let's continue. We are having another person here, Shamira Kantengwa. Is it okay for one to take fertility pills without medical advice due to delayed conception? Now, it is not advisable to take fertility medicines when you've not done tests. Because whatever medicine you're going to take, we need to first confirm that the problem is that, okay? We need to confirm that the problem you're having is this. For example, there are people who have fibroids. If your problem is fibroids, it means you're going to take medicines to remove, to shrink the fibroid. If the problem is your if the problem is your hormonal imbalance, then you can take medicines to balance those hormones. Okay? If the problem is blocked tubes, you're going to unblock the tubes. So the issue is not all about taking the medicines when you are not sure of the problem. So first get to know the problem, consult your doctor, let investigations be done, let us know why you're not able to conceive. Then after knowing why you're not able to conceive, you can now get the medicines specifically for that problem. Then we have another question here. I think it's from, someone is saying, hello from USA, hello, Salma, assalamu alaikum, wa alaikum salam. Then Blessing Ebi is saying, these are my cycle after I stopped family planning in October. The question. These are my cycles after I stopped family planning October 14th, December 28th. Seriously, how can I know when I am ovulating? Blessing, I want to invite you to go to the YouTube channel, check a video which has a heading. Please write this heading, Blessing. How to calculate my safe days, how to calculate my safe days, fertile days, and ovulation day in an irregular menstrual cycle. How to calculate my safe days, fertile days, and ovulation day in an irregular menstrual cycle. The last time, check a video which says how to calculate my safe days, fertile days, and ovulation day in an irregular menstrual cycle. Check that video, you'll learn, you'll understand you'll understand exactly what you want to know, because it's very clear, and I know it will you'll understand clearly. Okay, then okay, Lydia is saying, Doc, I had miscarriage in October. I did a scan and the doc says everything is okay, but I can't conceive. Please help me. A scan is not the only test that is done to find out why you cannot conceive. It is not only the scan. There are very many other tests that can be done. We have several tests, and I think I've always been listing those tests that can be done. So there are very many tests that can be done. So in other words, you don't only need to stop on an ultrasound scan. Try to carry out other tests to find out why you are not able to conceive. All right. Then we have GFF. Yes, hello. How are you and where are you calling from?
Doctor, I'm calling from Zambia.
You're calling from Zambia. Be very loud and specific with your question.
Okay, Doctor, I'm 39 this year.
Be loud. You're 39 years this year, yes?
Yes, in June. So I'm trying to conceive. I have my daughter, she's 12 years, and I'm trying to conceive. And I have this cycle which I don't know if it's 21 or 27, because it doesn't give me that space of seeing how lose your faith goes. So I don't know.
You said your cycle is how many days?
21.
21 days. So you want to know the days you can be able to conceive?
Yes.
All right. You have a penny there? All right. 21, simple arithmetics. If you answer these questions, you'll get your ovulation day. 21 minus 18, what do you get?
Is it 11?
21 minus 18. You say you're going to fail. 21 minus 18.
21 minus 18.
People should help you. Ask people to help you here. I'm not going to give you a free answer.
No, don't say that.
21 minus 18, what do you get? People are helping you. They're already putting the answer there. So 21 minus 18 is 3, okay? Then 3 plus 4, I'm giving you simple arithmetics. If you fail, I won't give you a free answer. People, don't give her an answer. Please don't give her. 3 plus 4. People already adding for you. 3 plus 4, what do you get? 7, all right. 7 plus 5. 7 plus 5 is 12. Okay. So that means you are fertile from the third day. All the answers we've gotten are landmarks. You are fertile from the third day of your periods up to the 12th day of your periods. But your ovulation day is on the 7th. So when you see your periods, make sure that you have sex. My people on YouTube know the answers. They are just rushing the answers here. Thank you so much. These people on YouTube are very serious. They have the answer. They already calculated it for you. They already gave you the answer. Your ovulation day is on the 7th. They have given you the answer. So it is on the 7th. So 7th, that is the day you'll be able to conceive. Is that all you wanted to ask?
Yes, because I've been doing, and then the other thing is, like last month, I did the deed.
You did the what?
But I did it. We had sex with my husband.
What do you mean? On 7th? On the 7th day?
Yes.
And you didn't conceive?
Yes, I did, and I didn't conceive.
Now you need to give us some more history, briefly. You said your last born is 12 years.
Yes.
What have you been doing in all these 12 years? Have you just failed to conceive, or you are using family planning?
I was using family planning.
Which method were you using?
Oh, I don't know if you know this, the Chinese one. I don't know.
You are using the Chinese pill. When did you stop the Chinese pill? We have problems here. We have problems. Chinese pills. When did you stop using that pill?
That was the last of last year. So we are talking
Last year. Now let me tell you this, and I'll be very clear with you people. That's why many countries in the world have abolished that Chinese pill. It is not well studied, and it is also associated with many side effects, and it has also been said that it is carcinogenic. But now, leaving that part alone, these drugs contain hormones. So they are going to cause hormonal imbalance. They are going to cause fluctuations within your body. And actually, most people, I've seen most of the people failing to conceive after using family planning. Most of them are using this Chinese pill. Every time you receive a woman, I've spent 4 years, I've spent 5 years, I'm not able to conceive. What happened to me? When you take history, you find that they are using a Chinese pill. Now, what you are supposed to do, you don't even need to target your ovulation day, because still you will not be able to conceive. What you're going to do is to run a full fertility hormonal, a full fertility screen. Let us identify which hormone went wrong, which hormone has a problem. Also look at your tubes. Let us know what exactly, this is what I call the fertility screen, to understand your fertility potential. When you get to know where the problem is, get the medicine for that. But I know with you, you are likely to be having a problem with your hormones. And most likely progesterone is having a problem. If you have a problem with your progesterone, those are the issues you receive. So before you even start targeting your ovulation day, first identify what is making you fail to conceive. Okay? I hope that is clear. I've answered you, and I think I should say bye-bye to you. All right. Okay, I think we are getting off. TikTok for now, and we are going to be remaining with YouTube for a few minutes until we finalize. So thank you so much for those of you who have been watching us from TikTok. We are continuing this live on YouTube. Go to YouTube and search for Ask Dr. UTHUMAN. The live is continuing right now. Thank you so much for those of you who have been on our live today. We continue with YouTube. All right, so we are continuing here with you guys on YouTube. You know I love you so much, you people on YouTube. That's why I always continue with you. So we have another question here. Baraka Asiyat is saying, hi doctor, I'm Baraka. For me, I got period on 1st January and 31st this very month. Is it normal? Yes, it is very normal. That is very normal. That is very normal, because if you look at 1st to 31st January, that is a difference of 30 days. So probably your cycle is 30 days. That is very, very normal. It's very normal. Then we have Lydia. I had a miscarriage. Doc said it because I am 40 years. Lydia, I had miscarriage. The doc said it is because I am 40 years. Is it normal? No. Being 40 years doesn't mean that you're going to get a miscarriage. No, that is not true. Being 40 years does not guarantee, does not make you get a miscarriage. Because we've seen women who conceive and deliver at 50 years. We've even found women 60 years, 69 years. I think it's just a few days ago. We delivered, a lady had never gotten pregnant in her entire life. She's 69, 62. We identified what the problem is. She was given medicines and she conceived at 50. She conceived at 62 years and gave birth. So being 40 years does not cause a miscarriage. Okay, so this is not true. However, of course, age comes with a lot of things. Maybe if because of the advanced age, you've gotten hormonal imbalance, you've gotten low levels of progesterone, that's when you'll not be able to conceive. Gemisola Aziz Abdul saying, I say if someone used IUD, is it possible not to see period? If we have two types of IUDs, we have the hormonal and the non-hormonal. If it's a hormonal IUD, yes, it is possible not to see periods. If it's a normal what we call copper T, non-hormonal IUD, then your periods have to remain there. Elisi Amabibi PB is saying, hello doc, saw a brown period on the 30th day of my cycle instead of 34 days cycle. I saw another period that is bright red 2 weeks after. I was told it was first menstruation. Was I pregnant? Now, it is possible to have been pregnant. Yes, it is possible, and that might have been what they call. It is not first pregnancy. It is called first. It is not called first menstruation. It is called implantational bleeding or implantational spotting. So that is what it is called. Susan Wangari is saying, hi doctor, which medicine to boost progesterone and estrogen? They are very low. We have medicines include progesterone itself. There are progesterone injections, there are progesterone tablets. Even estrogen, the same thing. There are tablets, there are even pessaries, injections, etc. for that. Brenda Pendy, hello doctor, what's the cause of being in a period for a long time? Because I'm not using any family planning method and I have spent 3 months. I need your help. First of all, we need you to quantify. What do you mean by being in a period for a long time? What does it mean? What does it mean by being in a period for a long time? Let us know what you're talking about. Long time means what? Means how many days? Because you may be calling it long time when it is normal. So for how many days? Quantify that. Ntale Jenny is saying, doctor, well done. Talk about the bladder prolapse and its treatment. Oh, I am sorry. I won't talk about this bladder prolapse. I do so much deal with fertility issues and those issues related to that. So Bladder prolapse, I think it can best be explained by probably those urologists and so on. But yeah, sorry, I will not talk about that. I'm not so good in that area. Then we have Lydia. My period lasts for 5 days. It changes to 7 days. Is it normal? Yes, it is normal, because if it changes to 7, as long as it has not gone beyond 7 days, we shall call it normal. Brenda Pendi, I have spent 3 months while in period. 3 months in a period is abnormal. 3 months in periods is absolutely abnormal. There is a problem. You may be having a problem with your hormones. You may be having a fibroid. You may be having endometriosis or any other problem. Do investigations to identify what the problem is. Of course, it is abnormal to be in your periods for 3 months. Okay. What's the time there? 2, eh? Past. All right. 2 minutes past. All right. Then this one is saying, Salome is saying, thank you, doctor. I'm watching you from South Africa. All right. Say hi to those people in South Africa. Then, okay, Florence Banda. Thank you, doctor. Watching from Zambia. Say hi to those Zambians. Takorabi Barbara. Doc, GHH is having an IUD in this body, but she's not having sex with her husband. Is the question. Oh, is when she remove, can it? All right. GHH, I've gotten you. So when you said that you're having, you inserted an IUD and you're not using it, you mean that you're not having sex. So you mean not having sex means you're not having, and you're not using an IUD. All right. It's fine. I've now understood the question. Takorabi, thank you so much. Now, yes, whether you are having sex or not, the IUD remains the same. So after removing it, you'll be able to conceive. Sorry that you're not having sex. It is very bad not to have sex. Sex is very good. Very, very important. It's very important. Sex is a medicine for very many things. I don't know. I think one time when I come to my live next time on Thursday, I first list the importances of sex. I will give you 50 serious major importances and values of sex medically. I will give them to you here in the live I will be having next time. It will be the opening statement, and then we go for your questions. So sorry about that, but you can still conceive even when you've not been having sex, as long as you've removed the IUD and you have unprotected sex. Okay, then Shamusa Lukwago is saying, hi doc, used the jasmine pills, but now it's a year not conceiving. Do fertility hormonal assay. Simple. Do a fertility hormonal assay. Morem Hase, how do I conceive a baby boy? Have sex on your ovulation day, or just 3 days to your ovulation day. You'll have a baby boy. Barry Mamudu is saying, Doctor, I don't know why some people are adding 14 or 18 when calculating their period. Which one is correct? For example, 29 minus 14. Me, I use 18. That is the formula I trust most. It is the formula I trust most. I think this should be the very last question. Thank you so much for watching my channel. Don't forget to subscribe. For those of you who are watching this channel, please do not forget to subscribe and press the notification bell in order to be notified of any video we release. And also share our videos so that we can get big numbers. Also, if you have a problem or an issue with your information technology, IT, if you want to know how different the tech world, how things work in terms of internet, in terms of computer and so on, please visit our YouTube channel. It's called IT.next. It is manned by the man behind my camera, and it's called Casebag for IT.next. Thank you so much, Casebag, for doing a very wonderful job, for putting me live on every Thursday, and is also the man behind our videos, those beautiful videos you see there, are being made by Casebag from it.next. Subscribe to his YouTube channel so that he can also gain from our audience. Please, if you know you're a very ardent supporter of Ask Dr. UTHUMAN, you're my ardent subscriber, please, this is a request, please subscribe for my man. it.next. Thank you so much. Have a lovely evening. Sign out.